Older patients often do complain about vaginal dryness, but we also see it in younger patients. This is often secondary to birth control use, especially low-dose birth control use. When you have a drop in estrogen levels, then the tissues in the vagina become drier and thinner and less flexible. Patients are often surprised about this, and they don't see it right at the start of birth control use. They'll see it perhaps after a year or two. Anything that alters your hormones, such as medications or breastfeeding or pregnancy, can then alter the tissues of the vagina and make them drier, less flexible, make it more painful for sex. For patients that have vaginal dryness because of low estrogen, this may be patients who are menopausal or patients who are breastfeeding, we can actually replace the estrogen in the vagina by giving an estrogen cream. The estrogen cream is used a couple of times a week, and patients will usually see a response in the first week. If a patient is experiencing vaginal dryness due to some sort of contact irritant, I have them eliminate it from their daily use. I tell patients to avoid perfumed soaps and bubble baths, avoid douches, avoid any wipes. They can kill the good bacteria in the vagina, and they have an overgrowth of the bad bacteria. This can result in a discharge that's very fishy. It's something called bacteria vaginosis. My best prescription for vaginal dryness and difficulties with sex is to have sex. You want the vagina to be used to having sex, and regular sex 1 to 2 times a week can keep the vagina flexible and lubricated.